Najwa, binti Md Yusoff.
Hello, hi, I'm Huda Jannah, binti Maliki.
Hi, Assalamualaikum. I am Amni Syamimi, binti Khairi.
3, 2, 1.
First of all, meningitis is an infection of the membranes which is called meninges that protect the spinal cord and brain. The meninges in brain consists of 3 layers, which is dura, arachnoid, and pia mater. Between the arachnoid and pia mater is the subarachnoid space containing blood vessels that supply the brain. When the membranes become infected, they swell and press on the spinal cord or brain. Meningitis typically affects the arachnoid, subarachnoid space, and pia mater. Meningitis symptoms strike suddenly and worsen quickly. Bacterial meningitis is a life-threatening condition that requires prompt recognition and treatment. Bacterial meningitis is caused by several different types of bacteria, including Streptococcus pneumonia, also called pneumococcus, Neisseria meningitidis, also called meningococcus, Haemophilus influenza, also called HIP, Listeria monocytogenes, Group B strep, and E. coli. Bacteria that cause meningitis can live in your body and the environment around us. In many cases, they are harmless. Bacterial meningitis occurs when these bacteria get in our bloodstream and travel to our brain and spinal cord to start an infection. Most bacteria that cause this form of infection are spread through close personal contact, such as coughing, sneezing, and kissing. An infected person's throat secretions like phlegm and saliva contain bacteria. When that person coughs or sneezes, the bacteria travel through the air. But most of the germs that can lead to the bacterial meningitis aren't contagious. In fact, the bacteria that cause meningitis are less contagious than viruses that cause the cold or flu. Not all bacteria that cause meningitis are spread from one person to another. We can also develop the bacterial meningitis after eating certain foods containing the Listeria bacterium, such as soft cheeses, hot dogs, and sandwich meat. Problems due to Listeria are more common in pregnant women, the elderly, and babies. Meningitis-causing bacteria are more likely to attack the membranes of the brain after the trauma, such as a head fracture, surgery, and a sinus infection. These conditions lower the immunity and disrupt the body's natural barriers, leaving the body open to infection of any kind, including the bacterial meningitis. Additionally, babies and people with weak immune systems are more likely to develop bacterial meningitis. It is important to note that the cause of an infection can be hard to pinpoint. Next, we discuss about the most common symptoms of bacterial meningitis, which is painful, stiff neck with limited range of motion, headaches, high fever, feeling confused or sleepy, bruising easily all over the body, a rash on the skin, and they tend to have sensitivity to light. Symptoms may develop over several hours or over a few days. If left untreated, infection may spread to the underlying brain tissue, causing loss of sensory and motor functions, coma, or even death. Depending on the causative agent and patient's age, death may occur as soon as within hours. Survivors may also be left with lifelong disability due to the brain damage. And these are the symptoms to look for in the children who have the bacterial meningitis, which is irritability, vomiting, frequent crying, swelling of the head, lack of appetite, seizures, which is also sometimes seen in adults if the meningitis is advanced. The symptoms typically come on quickly in as little as a couple of hours or up to 2 days. If an adult or child may have meningitis, they should go to an emergency room right away to seek the treatment. Next, we go to the prevalence of bacterial meningitis. According to World Health Organization, roughly 70% of meningitis cases occur in children under the age of 5 and in people over the age of 60. In the United States, bacterial meningitis affects about 4,000 people each year. HIP vaccination has reduced United States incidence of bacterial meningitis caused by Haemophilus influenza type B by approximately 90%. The disease is more prevalent in people between the age of 15 and 34 who have not been vaccinated. In worldwide, bacterial resistance to penicillin and other antibiotics and the lack of access to vaccines accounts for rising rates of bacterial meningitis. Over 1.2 million cases of bacterial meningitis are estimated to occur worldwide each year. The incidence and case fatality rates for bacterial meningitis vary by region, country, pathogen, and age group. Without treatment, the case fatality rate can be as high as 70%, and 1 in 5 survivors of bacterial meningitis may be left with permanent sequelae, including hearing loss, neurologic disability, or a loss of limb. Although meningitis affects all ages, young children are most at risk. Newborn babies are at most risk from Group B Streptococcus. Young children are at higher risk from meningococcus, pneumococcus, and Haemophilus influenza. Adolescents and young adults are at particular risk of meningococcal disease, while the elderly are at particular risk for pneumococcal disease. People all over the world are at risk of meningitis. The highest burden of disease is seen in a region of sub-Saharan Africa known as the African meningitis belt, especially recognized to be at high risk of epidemics of meningococcal but also pneumococcal meningitis. Higher risk is seen when people are living in close proximity, for example at mass gathering, in refugee camps, in overcrowded households, or in student, military, and other occupational settings. Immune deficiencies such as HIV infection or complement deficiency, immunosuppression, and active or passive smoking can also raise the risk of different types of meningitis.
For the diagnosis, the healthcare provider can diagnose meningitis based on medical history, a physical exam, and certain tests. During the exam, your provider may check for signs of infection around the head, ears, throat, and skin along the spine. There are 3 common tests to diagnose meningitis, which include blood testing, imaging, and lumbar puncture. For blood culture, a blood sample will be placed in a special dish or a slide and stained to see if it grows microorganisms such as bacteria. Then, it will be studied under a microscope to see whether the bacteria are present or not. The second one is imaging, which will be using computerized tomography, CT, or magnetic resonance imaging, MRI. Scans of the head may show swelling or inflammation. X-ray or CT scan of the chest or sinus may show an infection that may be associated with meningitis. The last test is lumbar puncture, which it will give us a definitive diagnosis of meningitis. It requires a spinal tap to collect the cerebrospinal fluid. If the person have meningitis, the fluid often show a low sugar level along with an increased white blood cell count and also increased protein. Analyzing this fluid may help us identify which bacteria that cause the meningitis.
I will explain about the treatment of bacterial meningitis. Acute bacterial meningitis must be treated right away with intravenous antibiotics and sometimes corticosteroids. This helps to ensure recovery and reduce the risk of complications such as brain swelling and seizures. The antibiotic or combination of antibiotics depends on the type of bacteria causing the infections. To treat the bacterial meningitis, 1 or more antibiotics that target the bacteria causing the infection will be given. These antibiotics commonly include cephalosporin antibiotics such as cefotaxime, clavurin, and ceftriaxone-razepine for Streptococcus pneumonia, Neisseria meningitidis, and ampicillin-resistant Haemophilus influenza type B Hep meningitis. Second, ampicillin omnipen, which is a penicillin class drug for Haemophilus influenza type B and Neisseria monocytogenes. The third one is vancomycin firvang, delivered intravenously for meningitis caused by several different types of bacteria strains. A number of other antibiotics may also be used, such as meropenem, merum, aminoglycoside antibiotics tobramycin, Tobi, and gentamicin, garamycin, ciprofloxacin, Cipro, and rifampin, rifadin, which are sometimes given to family members of people with bacterial meningitis to help protect them from catching the infections. But there are some arguments about, can a vaccine prevent bacterial meningitis? Vaccines cannot protect us from the non-infectious causes of meningitis, which include cancer, autoimmune disorders, and certain drugs. But meningitis vaccines can protect us from the three most common bacteria that cause the disease in children and adults, which are Neisseria meningitidis, Streptococcus pneumonia, and Haemophilus influenza type B, Hib, and also certain meningitis causing viruses.
We have 6 chains of infection during the event of an outbreak. The first one is pathogen, which is the first link in the chain of infection. Thus, for bacterial meningitis, the pathogen is the bacteria such as meningococcal bacteria, pneumococcal bacteria, and Haemophilus influenza type B bacteria. The second one is the reservoir. The reservoir is the principal habitat in which a pathogen lives, flourish, and is able to multiply. For bacterial meningitis, it is true natural human reservoir. The third one is the portal of exit, in which is a route which enables the pathogen to leave the host. For the bacterial meningitis case, one of the portal of exit is the respiratory through coughing, sneezing, and talking. The fourth one is the mode of transmission. For bacterial meningitis, it is transmitted by person to person by respiratory droplets or secretion from person with asymptomatic colonization or meningococcal disease. The bacteria attach to and multiply in the mucosal cell of the nasopharynx and oropharynx, and in a small proportion, much less than 1% of person, it will penetrate the mucosal cell and enter the bloodstream. The bacteria can then spread through the blood vessel to cause systemic disease and cross the blood-brain barrier into the cerebrospinal fluid to cause meningitis. The fifth is the portal of entry. The portal of entry means which an infection is able to enter the susceptible host. Thus, portal of entry of human body in this bacterial meningitis case include first, inhalation via the respiratory tract. The second one, ingestion via the gastrointestinal tract. People can get this E. coli bacteria by eating food prepared by people who did not wash their hand after using the toilet. Or also can get meningitis bacteria, which people spread this bacteria by sharing respiratory or throat secretion, for example, saliva or spit. The last one is transplacental, where the transmission of the mother to the fetus. Streptococcus bacteria can be passed by the mother to their babies during birth. Thus, who is very vulnerable to this bacterial meningitis? So the last chain of infection is susceptible host. The susceptible host depends on the variety of factors. The first one is age. For age, babies are at increased risk for bacterial meningitis compared to adults. The second one is group setting. This bacterial meningitis can easily spread where the large group of people gather rather than small group. Next one is certain medical condition, medication, or surgical procedure may put people at high risk of getting the bacterial meningitis. For example, having an HIV infection or cerebrospinal fluid leak, or having a spleen that can increase a person's risk for severe type of bacterial meningitis. Next is working with meningitis-causing pathogen. Usually, the microbiologists routinely exposed to this meningitis-causing bacteria. The last one is travelers. Travelers may be at high risk for meningococcal disease caused by meningitis. For example, if they travel to certain place like Sub-Saharan Africa, they may get the meningitis belt, particularly during the dry season, and also Mecca during the annual Hajj or Umrah pilgrimage.
Now we know about the 6 chains of infections. So, how to break the 6 chains of infections in the event of an outbreak? There are many different germs and infections inside and outside of the healthcare setting. Despite the variety of viruses and bacteria, germs spread from person to person through a common series of events. Therefore, to prevent germs from infecting more people, we must break the chain of infections at any link. No matter the germ, there are 6 points at which the chain can be broken and a germ can be stopped from infecting another person. The 6 links include the infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Break the chain by cleaning our hands frequently, staying up to date on the vaccines, including the flu shot, covering coughs and sneeze, and staying home when sick, following the rules for standard and contact isolation, using personal protective equipment, PPE the right way, cleaning and disinfecting the environment, sterilizing medical instruments and equipment, following safe injection practices, and using antibiotics wisely to prevent antibiotic resistance. I will briefly explain on how to break each chain of infections. First, how to break the pathogen link. Kill the pathogen, such as using antibiotics, incapacitate the pathogen or stop replication, remove or sequester the pathogen, such as by burning and burial. How to break the reservoir link. Eliminate the reservoir altogether, such as cats to eat the rats. Isolate the reservoir from at-risk population. Treat the reservoir, such as filtration of water supplies. Third, how to break portal of exit link. Block the pathogen as it leaves the reservoir, such as apply the cough etiquette. Prevent humans from accessing contents of reservoir. Eliminate egress of pathogen from reservoir. Fourth, how to break mode of transmission link. Mode of transmission can be direct contact, indirect contact, droplet, waterborne, foodborne, bloodborne, and airborne transmission. For direct contact, avoid contact such as no handshaking, no hugging, no skin-to-skin contact of any kind. Use barriers, PPE, and PPE that has been used must be discarded before it contaminates you or anyone else. For indirect contact transmission, avoid touching potential fomites to the extent possible, clean and disinfect fomites frequently, and provide hand sanitizer for people using fomites such as pens. How to break portal of entry link. Take good care of our skin. Use appropriate barrier PPE such as face shield and also face mask. Don't touch your eyes, nose, or other mucous membranes unless you have just washed your hands thoroughly. The last one, how to break susceptible host chain. There are 5 strategies to break this chain, which are immunity, such as reaching herd immunity in the population, resistance, avoidance of exposure, cocooning, which is vulnerable people should interact with vaccinated people, and pre or post-exposure prophylaxis to prevent development of the disease. Islam is referred to as the religion of cleanliness. Inna Allah yuhibbut tawwabin wa yuhibbul mutatahhirin. Truly, God loves those who turn unto Him in repentance and loves those who purify themselves. Surah Al-Baqarah, verse 222. In the traditions of Prophet Muhammad SAW, cleanliness is mentioned as half of faith. Therefore, it is important to keep the body fresh and clean, and Islam insists on several practices to facilitate this. They wash their hands, faces, including rinsing the mouth and nose, arms and feet a minimum of 5 times per day. Prophet Muhammad SAW insisted that the believers wash their hands before praying, before and after eating, and upon waking up in the morning. The teaching and principles of Islam are designed to benefit all of humankind. Rules and recommendations for personal hygiene and cleanliness promote the well-being of individuals and communities. Therefore, infection control is inherent in Islamic hygiene behavior.